Welcome to this webinar of the Jerusalem Press Club. I'm Uri Dromi, Director General of the club, and today we are privileged to host Professor Balicer. He's the Chief Innovation Officer of Clalit, the largest healthcare organization in Israel. Professor Balicer serves in the senior advisory groups to the World Health Organization, and more relevant to our talk today, he's chair of the National COVID-19 Expert Panel. Professor Balicer, thanks for taking the time to be with us today. First of all, these are great days. We've been waiting for the last 9 months or so for the vaccine, and here it is. So is this, to quote Winston Churchill, the beginning of the end or the end of the beginning?
That's a good one. I've thought about that quote a lot recently, and I do think that finally we can say that we are at the beginning of the end. I do think
complex
that
situations
this festive week that we've had right now of the first people getting vaccinated for COVID-19, myself included, is the beginning of getting control over the various impacts of this disease on our daily lives, on our health, on our mental health, on the society in large. And so this is a very important, I think, point in time where we can actually begin the count back towards the time when this disease would be just another ailment that comes, not every winter, but or year round, but is still one of those diseases that we just put aside and continue with our lives. And I think we're not that far from there. It's a matter of months.
The arrival of the vaccine was, as you mentioned, usually celebrated, but the implementation seems to be a bit problematic. People call the healthcare organization for hours to set the time to be vaccinated. What happens here, both on the national scene and perhaps more particularly in your own Clalit organization?
So, I think we have to commend all of the logistic arms of the government and the HMOs for being able to get this immense, monumental operation underway with very little problems until now, I have to say. This has come in as a very, understanding that we have to prepare for such a large logistical operation of vaccinating millions of people in such a short amount of time in an orderly fashion with vaccines that require a very strict cold chain and very strict rules of handling is non-trivial to any country. And the fact that we were able to do it so quickly and be one of the first countries to actually embark on the vaccination campaign in an orderly fashion, getting the right people to come and to get the vaccine, health workers and elderly first, and then there's a list of priority groups as we go along. I think that's quite an achievement. And yes, there's a line of waiting. People are anxious to get the vaccine, and they are not happy of the fact that they have to wait in line. But there's a capacity issue. We can vaccinate 60, perhaps 1,000 people per day, which is assuming the amount of vaccines that we have. That's approximately what is required, and that means that if there's 2 million people you want to vaccinate in the next time horizon, it does take time. It does take a few weeks, and everybody wants to be first in line, but it's not always possible. So considering all of these challenges, I think all of the HMOs and the Ministry of Health have dealt with it in a very respectful manner.
We know that right now, 1 of every 3 Israelis says that he or she will not be vaccinated. Perhaps it will change when more people take it. But what is the meaning of that? Because I guess that the idea is to achieve some kind of a herd immunity.
So this is a stepwise thing. It's not all or none. It's not either you have herd immunity or you don't. You have, by vaccinating the first tier of the high risk groups, you already have a great achievement in which you reduce dramatically the overall burden of the disease that is expected. Because the disease is not, the severe disease is very specific in the population that it targets. So you cannot compare morbidity among the young and healthy to the morbidity among the old and vulnerable. And so if you vaccinate the vulnerable, which in Israel, according to our calculation, is about 18% of the population, the elderly and those that are a little younger but do have a set of chronic diseases that put them at high risk, if you vaccinate 18% of the population, you can actually get a very high percentage, over 80% for sure, of the severe morbidity under control. And so this is the first step in which you vaccinate less than 20%, you get protection for over 80% of the severe cases, and that's a great step forward. The next step is the gradual vaccination of additional groups, especially those that are more likely to infect others. And once you do that, you can achieve a stronger reduction in the R, in the basic reproductive number of this disease, until a point in which there's over 50% of the people that are immune, or 60%, and then there's a high likelihood of reaching what is called herd immunity, which means that the virus cannot create mass dissemination because of the sheer likelihood that every person meets mainly vaccinated people. And so there's a natural reduction of the R below 1. So that's something to aspire for. In the process between 20% of the population and 60% of the population, every increase has an impact on R, an indirect effect. And so it's a gradual process. It will take months, but we're definitely on the way, and we can see the finish line. And yes, if 70% of the population will get vaccinated, I'm happy. I mean, the other 30%, I would recommend them to get vaccinated, but the public health impact would not be great.
In an op-ed in Haaretz, you wrote 3 months ago, you said that despite, and I'm quoting, despite the understandable frustration, in my opinion, right now, we must focus discourse not on accusations, but rather on solutions, the shared fate and the need to deal with all parts of society collectively in light of the serious challenges we are facing. Now, that's easier said than done, it seems, because if something comes out loud and clear from our experience in the last 9 months or so, it is the fact that two communities, the ultra-Orthodox and the Arabs, have a much higher rate of infection. But because of political reasons, the government refrains from dealing with them differentially, in a differential way. Now, if this is not enough, then we have elections looming over the horizon. So, and everybody will probably quote these communities. What is your assessment of the handling of the crisis in the coming weeks or months?
So there are some things that we are proud of that have been done and improved in a systematic manner during the dealing with the crisis. And there are many things that I'm not happy or content with and a little frustrated about our recommendations as experts that were not put into practice. Examples would be our recommendation to check and to those who come in the airports from abroad, and that is a continuous infusion of new cases coming into the country. That I think was one of the a key factor in the reinsertion of the disease after the second lockdown, and it should have been dealt with more quickly and more intensively, but that was not the case. I'm also not happy about some of our recommendations regarding the fact that we recommended that, for instance, education workers, teachers, and would be systematically screened before they come to work. So we will reduce the infection rates in schools, and that was done only halfway. And there's a set of other recommendations that were not really pushed from theory to practice. And I think as well as the control over mass gatherings that we have suggested more intensive dealing with them. And there was an attempt to do that, but not as far as, or not as intensive as one would have hoped. So all of this brings us to the point in which we are right now, where we're almost a touch, a distance from a safe harbor, but there's at least 2 months, if not 3, separating us between having the population at risk immune and vaccine then immune. And within those 2 months, if we do nothing right now, the rapid increase that we see right now in new cases, which resembles what was seen in Europe and what was seen here in September, is really something to worry about. Because if we do laissez-faire, if we continue what we've done in the last few weeks, the experts have recommended 2 weeks ago that we will not open the malls, that we will not open the open markets, that we will refrain and we will maintain vigilance and make more dedicated efforts to reduce the dissemination of the disease. Our recommendation was ignored, both as experts and as Ministry of Health, and all, as you know, all was open, and we can see the outcome of some of these decisions right now in the increase in infection rates. So now we will have to take much more severe actions in order to stop the disease from further disseminating and creating a very high toll in those coming 2 months that we are looking at. So the tough decisions now have to be made, and I'm sorry that we have to take them, but it seems like we have to.
And it will probably be difficult because times of elections, politicians want to be nice to people, not to impose severe measures on them.
Absolutely right. I will tell you what's the silver lining of an election coming in. My suggestion is that the government will make an excessive compensation scheme right now that would cause what in economics is indifference among these businesses that are at threat if we tighten up the regulation right now. And if you are able to financially make them indifferent for closing their business or restricting their business for a few weeks, I think that we can have it both ways. Not hurt the economy, not hurt the livelihood of people who are in dire need on one hand, and preserve public health and reduce morbidity and mortality that can be avoidable. And all of that can be done now, and it perhaps in some the minds of the economists could not be done earlier, because they said, God knows how many times we'll have to do this. And so we don't have all this money to spend indefinitely again and again and again. But this is not an again and again and again scenario. This is one-off. This is probably the last time we'll have to do this, because soon immunity will prevail. And so assuming that, we can spend more right now and have this work for us. But in anyhow, decisions need to be made very quickly, because waiting has its toll.
Josh Mitnick has a question. He says, health officials have reportedly spoken of vaccinating 60 to 80% of the population by April. Is that realistic?
We are aspiring for, I don't know, 50 to 60,000 per day. We can make the multiplications and see how realistic it is. But again, there's some things that are only something that we can assess, which is the logistics of increasing the ability to vaccinate. And there's some things which are beyond our control, which is the rate in which vaccines will actually arrive in Israel. But yes, assuming all of this, I can do the math pretty quickly, and I will tell you.
Another question, will Israel be able to hold in-person voting without risking a spike in the virus?
That's always that's a good question. That's not going to be an easy. I mean, how do you reconcile these two events? And we need to divide our question into 3 components. One is the general population. I see no problem with the general population going to vote, standing in line with large barriers, large distance between people, making sure that the voting areas are well ventilated, people maintain distance and masks. And I think we can do this. And also the epidemiology is that one singular day event does not change the epidemiology of a disease in a tremendous way. A more interesting question would be, how would you help the those who are quarantined to vote, and how would you help people who have active illness to vote, which is a little more complex. And to that, I don't have answers yet.
Okay, just when we thought we saw the light at the end of the tunnel, in comes the variant, which seems to be more cunning and perhaps more dangerous than the original COVID-19. What do we know about it?
This new variant emerged in England on September 20 and has become the most frequent strain to be isolated in 60% of the cases in London in recent weeks, and is continuing to spread. It has acquired an unusual number of mutations, which you would not expect in a coronavirus of its type, but it did manage to accumulate over 20 mutations, 17 which are allegedly were created almost at once. And there are various explanations to this in different papers that are now emerging. This new variant has accumulated several mutations which are more problematic, including in the receptor binding area of the spike protein, and some deletions that make it this virus less detectable by specific detection kits that are available in the UK, although not in Israel. And so there's and several other aspects to it that make it problematic. However, it should be made clear that this variant has not shown higher virulence. It doesn't cause more severe morbidity, and there's no evidence to date that the vaccine, neither the Moderna nor the Pfizer vaccine would be less effective or non-effective. But the studies are still ongoing, and clear response to that is still awaited. It is the fact that this variant seems to be disseminating faster, and there's a moderate to high certainty that it has higher infectivity. And if that is the case, then we are worried, because we do not want a more highly infectious virus to be spreading around the country in a time that we are making our best efforts to control it. And this is why we're trying to stall, as long as we can, the importation of this new variant to Israel, as several other countries have been trying. And this is not easy at this point in time.
Alfred Miller asks, what about people who already who are sick with the coronavirus? Are there any new medications helping them?
Almost all of the studies were negative on severe COVID-19. The steroids do work and are very effective. Several other promising drugs have been quite unhelpful. In several studies, it was shown that they were a little disappointing, and there was negative results. They did not help. And so, no, I think we don't have a very large arsenal of protection, pharmacological protection, once there's a severe disease. So it's best not to contract the virus and not have a severe disease. By that point, there's not that much that we've been able to devise in the last 6 months above and beyond steroids and the right way of supportive treatment and ventilation.
Alfred Muller has another question. Are you aware of any contacts with the Palestinian Authority to share vaccines with them?
That's not part of my realm of responsibility, so I have little know-how on this.
Okay. A nationwide lockdown is always on the agenda, sometimes as a threat to the public behave, or sometimes as a real option when the rate of infection rises dramatically. You yourself have been cautious always about a total lockdown. And now with the vaccine, perhaps it's not necessary anymore. But on the other hand, with the variant, and we already learned the hard way how elusive this pandemic is. So will you change your position on lockdown if situation changes?
Look, lockdown is an extreme, devastating step that you take as a last measure, when the last option, when all other options failed. And it is when this is the least or the less bad option that you have. You should do everything that you can in order to avoid the need to use it. It is true that if you refrain from taking more lighter measures for a long while, and the situation becomes too dire, you are in a point of bad options where the lockdown is not the worst one. And in those cases, you do take it. It's, as far as I'm concerned, it is, each time it is used, it is a recognition of failure of all of your efforts to that point. It is not a strategy. It is the lack thereof of a strategy. And so I am unhappy whenever it reaches a point where it has to be, this sword has to be drawn. I'm afraid that we're getting closer now to the point in which we are once again, in a point in which some type of, severe restrictions are badly needed right now. But full lockdown, if we wait longer, then that might become not the worst options of all. But we really should try to do everything else within our power in order not to close down schools, and not to hurt the ability of people to get out and get fresh air, and not to hurt the economy in a way that is excessive as compared to the alternatives. So yeah, it could become a necessity, and actually we're moving closer and closer to that point by the day. Today was a very bad day. Today we have reached new heights of infection, and I am very worried about the decisions we'll have to take in the next few days.
Last but not least, Professor Balicer, what do you hear from your colleagues abroad? Are there any new insights, something we can learn from a comparative study or looking around?
The most important thing to learn is that the unhappiness that this virus delivers is almost identical in the very different settings and scenarios. And it is the potential of this virus to make very quick ascent of cases. And people for a while thought that some countries have figured it out, and that they've reached a way of some kind of natural herd immunity of sorts. And that if you let it rip, it is a strategy that should be considered. Maybe it helps the economy. I think by now it has become more and more evident that this type of approach is reckless, and that no country.
Sweden, you mean Sweden?
Not necessarily just Sweden. I mean, Sweden was given as one example, but again, every country, and Sweden included, that has relaxed its measures has seen a fast and furious increase in cases. As we have seen in September, no country is exempt. No country has a natural herd immunity. We all have to take this virus very seriously until the point in time in which most of our population is protected. And until then, we have to be very cautious and be very vigilant and be very quick in our mitigation efforts. And if you don't do early mitigation, then you have to do late, painful, and destructive mitigation efforts, and which are always less advised.
The conventional wisdom is that the pandemic changed everything, and we now have to reshape our thinking about everything. Let's talk about public health in Israel. Do you think what will be the long-term implications of this pandemic on that important area?
I can tell you my hopes. I do hope that this will open the eyes of decision makers of all aspects of society, economics included, to understand that we have to strengthen the infrastructure, both of the healthcare system and its capacity, and its surge capacity, as well as the public health infrastructure that was a little bit left behind for many years. And I hope that we'll come out of this event when it is clear to everyone that resources and attention should be dedicated to strengthening our very thin and one would say almost starving healthcare system, and increase its capacity and its surge capacity to deal with disasters, because at that point, it becomes a matter of huge impact on the entire economy and not just on the patients, their families, and their loved ones. So I do hope that this type of insight and this type of resource allocation is something that is going to change.
Professor Balicer, it's always a pleasure to host you. Thank you so much. I'd like to thank my colleagues at JPC, Talia Decker, Rachel Exziel, for facilitating this webinar. Stay tuned to our next event, which will obviously follow the unfolding political drama in Israel. And season's greetings to our friends everywhere, and stay safe. Thank you.
We hope you enjoyed that briefing by the Jerusalem Press Club. If you did, like the video and hit the subscribe button to stay up to date with all of our future content.